Well, good afternoon. I'm Greg Cox, Chairman of the San Diego County Board of Supervisors, and we want to welcome you to our continuum media and public updates on the coronavirus. We're sticking to the same format today as we did yesterday. We're going to be joined today by Supervisor Nathan Fletcher, who's serving as the board coronavirus subcommittee along with myself. But I want to acknowledge that the other members of the Board of Supervisors, Supervisor Kristen Gaspar, Supervisor Jim Desmond, and Supervisor Diane Jacob, are all working in their districts and doing great things in getting the word out to their constituents and to the residents of San Diego County. I know yesterday Supervisor Desmond and Supervisor Gaspar had a briefing for the business community up in North County. They did a great job in explaining what's going on at the county. I know Supervisor Jacob has been meeting with community groups and having conference calls. And I just wanted to compliment them for the great team effort that we have going here at the County of San Diego. We also have with us today Dr. Wilma Wooten, who you'll be going to hear from shortly, our County Public Health Officer, and Dr. Eric McDonald, our Director of the county's Epidemiology and Immunization Services Branch, and also Dr. Nick Ifantides, our Chief Medical Officer for the County of San Diego. And in order to get started today, we'll go ahead and have the report from Dr. Wilma Wooten, and she'll be followed by Dr. McDonald.
Good afternoon, everyone, and thank you, Supervisor Cox. We are here today to provide an update on the COVID-19 outbreak in San Diego County. Regarding cases, as of 5 p.m. yesterday, we are reporting 60 cases, which is 5 more than the total number reported the day before. And at close of business today, we will know what our run for the day, total count for today is. While the county is not at this time recommending shelter in place, and I know that you've heard about that in other jurisdictions, we are asking all San Diego residents to refrain from convening gatherings of 10 or more individuals. And we continue to strongly recommend that all non-essential gatherings of any size be discouraged. We have made some updates to the order issued on Monday, and for clarification, I'd like to provide that additional information now. Section 2 of the amended health officer order shall be amended as follows. All bars, adult entertainment establishments, and other business establishments that serve alcohol shall close. All gyms and fitness centers shall close. Section 5 of the amended health officer order shall be amended as follows. All public or private schools, colleges, and universities shall not hold classes or other school activities where students gather on the campus. Parents of school-aged minor children shall take steps to ensure said children are not participating in activities prohibited by the order and that social distancing requirements are practiced. To the extent possible, daycare and child care facilities shall operate under the following conditions. Child care must be carried out in stable groups of 10 or fewer. Stable means that the same 10 or fewer children are in the same group each day. Children shall not change from one group to another, and if more than one group of children is cared for at one facility, each group shall be in a separate room. Groups shall not mix with each other, and child care providers shall remain solely with one group of children. For the purpose of prohibiting all public gatherings, Section 20A of the amended health officer order shall read, gatherings is an event or convening that brings together 10 or more people in a single room or single space at the same time, such as an auditorium, stadium, arena, theater, church, casino, conference room, meeting hall, cafeteria, or for the purpose of stating exemptions, Section 20EI of the amended health officer order is amended to read that the health officer order does not prohibit operations at airports, public transportation, or other spaces where 10 or more people may be in transit, but able to practice social distancing. It also does not include essential businesses where many people are present but are able to practice social distancing. Section 21, and this is the last amendment. Section 21 of the amended health officer order is amended as follows. Gathering of less than 10 people are strongly encouraged to maintain social distancing pursuant to the Department of Public Health guidelines. So those are the changes, and these modifications are effective as of midnight tonight. So those are the amendments that have been made. And I've shared with you the fact that we have 60 new cases, and I just want to share some additional demographic information. Of that total number, we have 47 that are between 18 and 64 years of age. There are no cases 0 to 17. We have 13 cases 65 years and older. Now, the total of 60 cases includes 51 that are San Diego County residents, 5 that are individuals from the federal quarantine, and 4 are non-San Diego County residents. Of the total 60, 21 are female, 39 are male, and 10 of the 60 have been hospitalized, and thankfully, we do not have any deaths. That concludes my presentation. And I think Dr. McDonald will now come to this podium and provide additional information about our Miramar situation and other events that have occurred.
Thank you, Dr. Wooten. Good afternoon. I'm going to start this with an update on the situation at Miramar. There were a total of 238 individuals in federal quarantine as of this morning, and 38 were scheduled to leave today. I don't know that they've actually physically left yet, but that was the schedule. It's important to note that the quarantine for these individuals who are not having symptoms will actually end next Tuesday, so we're over halfway through their time period. Among the individuals who were there are 136 individuals from California, 2 from San Diego, and as I said in yesterday's briefing, we are maintaining contact with our local residents. We also had a cruise ship, the Eurodam, which docked this morning at 6 a.m. and disembarked passengers and some crew members. Those individuals are all headed to their homes. The cruise is over. I want to say that there are no COVID-19 cases on the ship. Our health department worked closely with the port, the cruise ship company, Holland America, the Coast Guard, the local CDC quarantine station, and the leads of the CDC cruise ship task force in Atlanta to ensure that the passengers on this cruise ship safely disembarked to proceed to their homes to start a 14-day self-quarantine. The local CDC quarantine station has the lead in determining that it is safe for individuals to disembark from any cruise ship that has been in international waters. And they followed their policies and procedures to make sure that their standards were met. The ship came in with 1,839 passengers, and those individuals have all departed, as well as 61 of the over 800 crew members. My understanding from the cruise ship company is that the ship will be leaving today and going to Ensenada tomorrow with the remainder of the crew. Of those who departed the ship today, 274 of those individuals are Californians, and we are actually awaiting detailed information on the names and addresses of those who are San Diego County residents. Our health department will be following up with those individuals to make sure that they complete their 14-day quarantine. There were 3 individuals that were sent to local hospitals for medical evaluation, and information is pending about those cases. All of the other departing passengers had no current medical complaints. Self-quarantine after a cruise is now recommended by the CDC for all cruise ship passengers throughout the country. And nothing in the itinerary of this cruise or reports of any illnesses on the ship raise any undue concern or risk for COVID-19. I think that's important context, that it is a CDC directive that all individuals on cruise ships who disembark from international waters proceed home immediately upon disembarking, and then go into a 14-day quarantine as if they had come from a country that had sustained local transmission, such as Italy or Japan or Iran. Those are my brief updates, and then I'll be answering questions later.
Next up is Supervisor Nathan Fletcher to give us an update on the homeless situation.
Thank you, Supervisor Cox, and thank you to our public health doctors who are here today. Today's actions represent a continued escalation in our response to the COVID-19 outbreak in proportion to the continued escalation of the numbers. We do all operate under the assumption that the numbers that we have available are lower than the actual impact because of the limitations in testing, limitations we are working fiercely to try and bring more online. But I think it is really important to reinforce to the public that when we lower public gatherings from 50 to 10, we need folks to heed these warnings. When we say even gatherings of 10 or less need to maintain appropriate social distancing, we need the public's participation and help in these efforts if we are going to truly flatten the curve and do our very best to preserve the integrity of our healthcare system. I know of particular concern surrounding the impacts of COVID-19 is the impact on our unsheltered populations and communities, and we have been working very hard to come up with systems and processes in place where we can help mitigate the impact of this on those homeless individuals throughout San Diego County. We had a sector call today with homeless providers and with those involved in this to share information, and we wanted to update the broader public. To date, 277 hand washing stations have been requested by jurisdictions throughout San Diego County. Both cities, along with state parks, transit agencies, and other entities. Of those, 187 have been placed. The remaining 90 are in process and will be placed shortly in due time. We also have the capacity, as we get additional requests, to continue to fulfill those requests. We have public health nurses in our 4 bridge shelters. We are moving to get public health nurses into other shelter locations throughout San Diego County, and we will keep you updated as we do that. We have public health nurses currently in 7 homeless outreach teams. We are in the process of expanding that to 9 additional homeless outreach teams, which will, once that's fulfilled, give us public health nurses in 16 homeless outreach teams. The aim of these individuals in the shelters and the aim of those that are in the homeless outreach teams is twofold. One, it is to provide information, to provide hygiene information for the homeless outreach teams. It is to provide hygiene kits. It is to make our unsheltered communities aware of what they can do to protect themselves and help themselves. But secondarily, it's to identify unsheltered individuals who are exhibiting symptoms or signs of COVID-19, and then to be in a position to get those individuals out of a congregate care setting, out of an encampment, out of an area where they are around other individuals. And we do that via the motel rooms that we have secured. To date, the County of San Diego has 1,472 motel rooms available. Individuals are beginning to fill these rooms, and in the coming days, we will be able to report on the occupancy of these. There are various locations across the region, and we appreciate our partners in the tourism industry for stepping up and making these available. We've prepared a chart to walk through the categories of these rooms and how individuals can access them to provide greater clarity towards what we are doing. On the chart, you will see that these rooms are not just for homeless individuals, and this is a really important point to make. The rooms that the County of San Diego has are not just for the homeless. The rooms the County of San Diego has is for individuals who have tested positive, who are a person under investigation, or a person exhibiting symptoms who does not have the ability or the capacity to self-isolate at home. So this could be a senior citizen who lives in a senior home who doesn't have the ability to go home if they're showing symptoms, but we don't want them to remain in that place. It could be an individual being discharged from a hospital that doesn't have the ability to go home. It could be someone who lives in a one-room apartment with 6 or 7 other people. Or it could be someone who is unsheltered. But these rooms are available for individuals who have tested positive, for individuals who are a person under investigation, or for individuals who are exhibiting symptoms to make sure that we can get them in an environment where they can isolate. So on the chart that we've laid out, you will see general, this is people needing isolation assistance. Positive, pending results, or symptomatic. They'll be evaluated by a physician or a nurse practitioner who have ruled out other diagnoses. They have to be able to maintain activities of daily living. What that means is these individuals have to be able to feed themselves and bathe themselves and generally care for themselves. The intake for these individuals will be through the County of San Diego temporary lodging call line, and the services delivered will be provided by the County of San Diego. These services involve transportation, meals, laundry, cleaning, room maintenance, along with daily phone wellness checks to make sure that they are doing okay. We are sharing this information with the medical community so that they have it. The second category is individuals who are homeless. If the individual is unsheltered or sheltered, they could be sheltered in one of our bridge shelters or they could be on the streets, and they are showing symptoms, they are symptomatic. The public health nurse who evaluates them and determines that they have symptoms will give them the opportunity to leave and go to a motel setting. They also have to be able to maintain the activities of daily living. The intake in this will be through the County of San Diego, our public health nurses who are on site, along with the temporary lodging call line, which has been provided to our homeless providers, along with our medical community. These unsheltered individuals will go to a motel where they will continue to be assessed and monitored for the appropriate level of care that is important. The Regional Task Force on the Homeless has a separate category of rooms that they are administering. We are paying for them initially. They will likely acquire some on their own that they will pay for. But as of today, we are taking 100 rooms out of our inventory of rooms and allocating those to the Regional Task Force on Homeless. The Regional Task Force on Homeless can put anyone into these rooms that they determine needs a motel room and shelter. Their priority will be individuals who are 65 years or older with chronic medical conditions, compromised immune systems. They have identified a listing of these folks who match that criteria. They will be an outreach to them. They will transport them. For these 100 rooms, the County of San Diego will continue to pay for all the services that I have outlined. The Regional Task Force on Homeless in the state of California may secure additional rooms that will be in these categories. If they do that, then they will be providing those services. We will also continue to assess our inventory of rooms. It is very important that in San Diego County, we maintain space for individuals who are positive, persons under investigation or who have symptoms, who don't have somewhere to go. We want those individuals to have a place to go. We also want to ensure that we are offloading rooms as appropriate to the Regional Task Force on Homeless so that they can begin to fill those. And the essence of this system working, particularly for the unsheltered population, is our public health nurses who will be out there. We've been working closely with Bob McElroy and other shelter providers who are here. Our nurses will be on site. They will be there to screen individuals as they come in. I appreciate Bob's patience as we've worked through this and his cooperation and collaboration. Bob has committed that as individuals leave and a bed is available, he'll be willing to take a new individual into that bed, provided that we screen that individual upon entry for symptoms or for services. I also want to point out that the gathering space that was outlined today, there is an exemption for homeless shelters in that they do not have to adhere to the 10-person for mass gatherings because that's simply not the nature of the way homeless shelters work. But we are requiring our shelters in the food setting type environments and anything outside of the birthing area to limit those gatherings to 10 and ensure social distancing. So we understand that in the broad shelter environment, you can't have it limited to 10 and you can't do that. But in those feeding areas and those other activities outside of the core birthing areas, we need you to limit those to 10 per person, and we want to ensure that we're maintaining social distancing. So again, of the rooms we have available, the county has one category for general folks needing isolation assistance, also homeless individuals who have exhibited symptoms. We are giving Regional Task Force on Homeless 100 initial rooms. They will fill those for individuals who have no symptoms, but have underlying health conditions or ages, and we will continue to all work to acquire more capacity and more rooms in this environment. And then in closing, I think the advice and guidance that's being given today is something that all of us really have to take to heart. The reality is that we are escalating the measures that we are asking the public to take because the situation is escalating, and we are concerned about preserving the integrity of our healthcare system. I remember in Marine Corps training being told one time that we were being trained and asked to do things in an effort not only to make sure that we weren't injured or killed, but to make sure that our failure to do what we were asked to do didn't injure or kill someone else. And so we're asking the public in San Diego to please heed this advice and warnings. Because although you may not be worried about the impact on yourself, your failure to follow these steps could be the thing that impacts someone who you love and care about. And we all have within our power the ability to slow the spread of this and the actions that we take. When we choose to do proper sanitation, things like hand washing, when we choose to avoid mass gatherings, right? When we choose to come together as a community and work to slow the spread of this, we can have a tremendously positive impact and we can get through this in a much stronger position. So we're thankful for all of our public health experts, their tireless work and everything they're doing, along with all of the folks out in the community who we're working with every single day to try and tackle this issue. And we will continue to provide future updates as needed. Thank you.
Thank you, Nathan. As yesterday, we will open it up to questions. We would ask you to please step up to the microphone, state your name and the outlet that you're with, and we'll get the appropriate person to respond.
Will Hunsberry, Voice of San Diego. My understanding of how ordering is working for hospitals right now is that their orders are going through county public health, and that's something that happens in an emergency like we're in. And so hospitals, some of them are saying that they're critically low on protective gear like masks, but not just masks, gowns, and also gloves. So I'm wondering if you can define the scope of the shortage of these materials in hospitals, and also define the scope of materials that the county has access to, because the hospitals are asking the county for these materials. So how much materials can you get, and when will you get them to the hospitals?
Thank you, sir, for your very thoughtful question. And like many, there's nuances here. First, I want to frame this discussion in terms of what you see us doing here. In addition to being focused on the health and well-being of our community, it is also about protecting the stewardship of our healthcare delivery system. You often hear about the concerns that are related to the availability of intensive care units and respirators. But part of the issues that you raise with your question really reflect an even broader concern, and that is the ability that we have to do everything to protect another key asset of the healthcare delivery system, and that is the healthcare workers. It is fair to say that there are some concerns about the availability of personal protective equipment. What I can tell you is that the relationship that exists between all of the local hospitals and all of the local physicians through the medical society and a host of different medical groups is as optimal as it could ever be. And there is a mechanism in place for the county to support and respond to those needs appropriately and promptly. As we look ahead, there is honestly some levels of concern about the future capacity of some of these PPE, as they are called, which is part of the whole reason that the message here is also about appropriate utilization of the current healthcare system. We have to ensure that the people that are accessing healthcare are doing so appropriately. Right now, to answer your question matter-of-factly, There are no shortages. Everybody in this region has what they need. But on our radar is the potential, and this is not just a local issue. This is a national issue that is being addressed with release of stockpiles, with release of optimal coordination, with opportunities to do procurement to ensure that all of this supplies, not just the high-end intensive care and respirators, but all of the supplies and the humans that are needed will be optimally available.
So let me just follow up really quickly, because the no shortages part is confusing given the CDC guidance. The CDC guidance, I believe, says that healthcare workers should use an N95 if there's enough supply to meet demand. You guys have now moved to droplet precautions, and so you're asking them not to use those. So that makes it sound like there's clearly not enough supply to meet demand. So again, I just want to push you to define the scope of where we're at right now, and what can the county get to hospitals, and when can they get it to the hospitals that are already asking for it?
Yes, sir. And again, a great question. I'm going to just answer quickly and say that there is a very good observation that you have made with regard to this movement from guidance of aerosol to droplets. And I will allow my colleague, Dr. McDonald, to unpack a little bit more the implications of that in terms of the specific N95s versus surgical masks and so forth.
Thanks. The guidance from CDC has been changing, and this really is about projecting into the future in terms of demands and supply. And because there is a concern about future supply, it's important for us to appropriately adjust demand in the short run. And the current CDC guidance, which is evidence-based on what we know about the virus, is droplet precautions unless you are in a procedure that generates an aerosol. In that case, you need to have aerosol precautions. So earlier on, when there was less known and there was less certainty about projections in the future of demand, it was thought to maintain a aerosol protection posture from the beginning, but that was recognized nationally to be unsustainable. So by changing those rules based on evidence, but the CDC has indicated that this is the appropriate protection for healthcare workers. And we expect that the supply and demand will be matched. But again, we can't predict the future. It really gets to the heart of your question is, again, things are okay now, but we anticipate that as industry revs up to supply more product, that the demand and supply will be matched.
The last part was just, when do you think you will be able to get more supplies to hospitals? Because my understanding is they're already asking the county public health for more supplies. So when will you be able to get them more supplies?
Again, that's really dependent on things that are outside the county's control. That is the supply and the strategic national stockpile, and when industry can produce. And again, it's prudent for us to adjust our demand appropriately to make sure that our healthcare workers know what the current protective posture is that they should be acting under, and using it appropriately, again, to reduce demand. And that's really the best answer I can give you.
Okay, let's go to a question over here.
Hi, Gary Worth, San Diego Union Tribune. Kind of a related question. I know of two of the bridge shelters said that they're kind of running low on hand sanitizers. And Escondido Interfaith Community Service also has a shelter, and they were actually asking for donations from the public if anybody had some. Is there a fear that we might run low on the solutions that are in our hand washing stations? And also, is there a supply out there for this particular population? They're just going through vendors like everybody else and saying, that there's a wait. We know that the state of New York had made their own, and we're distributing it. I don't know if the state of California, you might have heard, might have some kind of plan like that, or maybe even in the county, somebody could do it.
All right, Dr. McDonald?
Yeah, I'll answer that in two ways. Number one, soap and water is best. okay? And there's plenty of soap and plenty of water, okay? So that's number one. But we recognize that there are some instances in which hand sanitizer is more optimal in certain situations. And interestingly, the FDA just today released actually a recipe for how to produce your own hand sanitizer. And I would point to that to have individuals look and to see how to do that. We're also looking at other alternatives for the commercially produced product. We hope, again, it goes back to the other supply question, we hope, again, that as industry revs up, demand will be met, and people need to be using hand sanitizer appropriately. But really, remember, hand sanitizer is a substitute for soap and water, and there's plenty of that.
Okay, over here.
I have a sort of a follow-up related question to what Gary had asked. I'm wondering about what are the protocols when somebody is identified potentially in a shelter as showing symptoms, and how transport works then to and connection to the motels. And then separately, are there adequate supplies of other sorts, such as, you know, things to take their temperature with and PPE equipment for the folks that are in there doing those tests?
In terms of supply, it's a lot. It reminds me of the questions that we get asked every flu season because people have trouble getting flu antivirals when they went to the one pharmacy that they tried. We just don't have granular information like that at that very individual level. We do hear reports when individuals go to a specific place and a specific supplier to get a specific item that they can't get it. Just as when you go to the certain store that's had a run on toilet paper, there's no toilet paper left. But overall, there isn't a toilet paper problem in the country. The toilet paper is flowing through the system. So we think that we should be able to, in the micro, be able to match supply and demand, but that's really an individual type of challenge that really we can't micromanage at the county level.
But to be clear, what I'm asking about is, are those items available for people being tested in our homeless shelters? Do the workers in those shelters and the public health nurses have PPE and have thermometers to be giving these tests, and how does that process work?
Yes,
Ideally.
absolutely. Our nurses have the appropriate personal protective equipment when they are assessing someone that may have COVID-19, they might have influenza, they might have other respiratory illnesses. So our nurses and staff do have the appropriate personal protective equipment. We have thermometers, so that is not an issue right now, but it could be obviously in the future. And our process is to try to have enough supplies, at least for anywhere from a 4 to 6 week period, and then try to replenish that so we do not run out.
And what is the testing protocol for someone who may show up at a shelter or actually be in the shelter to be tested? And what happens if there is a belief that this person may in fact have COVID-19?
So I will start and Dr. McDonald can finish. If an individual is assessed, our nurses are out in the shelters from 3 to 9 each day. If individuals are assessed and they are found to have influenza-like illnesses, because we don't know if it's just influenza or COVID-19, they are separated from the rest of the guests at the facility, and then there is a process where transportation is arranged for them to be taken to one of the locations that Supervisor Fletcher talked about. So that's the process, and once they get to that location, because our nurses are not doctors, so they can't make a diagnosis, what they do is document the symptoms, and then they are transported to the location, whether they are a person under investigation, or if it's someone that has been hospitalized and no longer is sick enough to be in the hospital, they will also be taken to that location. But then once they are there, then there is a team that will go and assess and obtain specimens so that those specimens can be processed. If someone is sick enough to go to the hospital, they will go to the hospital. Dr. McDonald.
Does the county provide the transport for those individuals? I heard some confusion about that today.
Let me go and ask address the test question, and maybe somebody else should get a chance to ask a question. testing is an important issue, and there is, in fact, today, a shortage of the tests to be able to conduct all the tests that we want. In spite of the delivery or the comments at the national level about delivery of kits is not the only requirement to actually run a test. You have to have reagents to run those tests, and those are also in very short supply. So it's important to know that that there might be a turnaround time for a test result to come back, and in the meantime, people need to be isolated and treated as if they had COVID-19, whether that's a person in the field or one of this homeless homeless example that you're giving. It's important to know that that the test does not determine your public health action in the short run. The public health action in the short run, or the individual action in the short run, is to isolate the individual, and however long it takes for the test to come back. And I want people to get out of the idea that you have to have a test to know what to do. No, you need to stay home if you're sick, be isolated, not interact with others if you have the signs and symptoms. You should do that regardless, and you don't need a test, actually, to do those things. There are specific people that we do need to test, and those at this time are those who are ill in the hospital or in specific situations that have a need for public health action. So everyone is fixated on the test, and I understand that. Everyone is frustrated that we don't have all the tests that we would like to have at this time. We hope that they're available in 2 to 3 weeks, but that is the time frame that we're talking about in order to have the amount of testing that we need to meet the current demand. So that's why we're being selective in where the testing is applied. That's not just an issue with the local health department and our public health lab. It's an issue for everyone, including the commercial labs. And so, again, people should take action based on symptoms, not on the test result.
Okay, let's go to a question over here.
Artie Ojeda from NBC7. With regards to the numbers, I'm going to ask you to clarify some of the numbers, Dr. Wooten. First of all, and this is important to our military community, are the military members included in those total numbers, first of all?
No,
Also,
might want to do it, but.
there's a higher number within the age range of 18 to 64. I want your analysis on that. Is that expected? What does that tell you? And then also, and I apologize for throwing all these out at you, you mentioned specifically casinos and theaters in the new limitations of 10 people. How are you going to enforce that?
So let me make one comment just to follow up from Dr. McDonald. When we have congregate living facilities, we might do a couple of testing for individuals that develop ILI, just much like we do with influenza. And say for instance, if there were individuals that tested positive for COVID-19, as people continue to have symptoms, we wouldn't test everybody because we've confirmed an outbreak in that area. So that's another way that we utilize testing. And Dr. McDonald is absolutely right. Everyone does not need to be tested. Individuals with mild to moderate symptoms, we are asking them to stay at home and only consult or see a doctor if they have complications or develop severe respiratory symptoms. So I just wanted to make those points clear. So I may have to ask you, the first question was, I'm going to go to the age question. So that was a broad range, the age range that we gave you. If we broke that down, most of the individuals are over 50. They are the older adults. Our youngest is about 21, and the oldest is 82, if I recall the line list age group, ages. So, but this virus infects, it doesn't discriminate. Anyone who's exposed potentially could develop symptoms. So I hope that answers.
Well, is there anything to deduce from that it is impacting people over 50 or of a certain age, or is this just totally indiscriminate and just random?
Influenza affects primarily those individuals that are older, that have underlying medical conditions. We have not been doing research on this. There are others that are doing the research, but the information that we have gotten from CDC suggests that it's much like influenza. It impacts those individuals that are older and those individuals that have underlying medical conditions and those individuals that have compromised immune systems. So that's why we are trying to separate and asking individuals that are 65 years of age and older to stay at home and not go out into the general public.
Okay, and then with regards to the military?
Yeah, so number one, the military cases that have been reported to us are included in our numbers. That's number one. And number two, I would not make any deductions about what's going on in the community based on what's being reported to us in terms of the cases. That is very subject to who's being tested. Okay, so we know, for example, the Navy Health Research Center is doing a lot of testing for military folks, and so we are probably overrepresenting individuals from the military coming in terms of reports. We are also concentrating our testing, as I said before, in terms of the people who are very ill. We're not testing the individuals who are not ill, probably the majority of the cases. So I would only interpret the numbers as a tip of an iceberg in terms of the cases that are being reported versus that are actually in the community, which supports all of the actions that we're taking and asking the public to do social distancing and adhere to the health officer order that has been promulgated. Again, most of the people who get COVID-19 don't need to see a doctor, aren't really presenting for care, have very mild symptoms. And so the ones we know about who get tested are being tested for very specific reasons. So I would not deduce anything based on the distribution of the reported cases.
Okay, question over here.
I do have to follow up. Just the question of the casinos. How are you going to enforce a limit of 10 or less at casinos and theaters?
We recognize that most businesses, most individuals are going to comply with the recommendations that are being made. But we know some people or some organizations or businesses may not. So as we hear about any events or situations that violate our orders, we will investigate.
Yeah, just to reemphasize, these orders or directives do have the force of law, and our sheriff's department and the local police departments will be making sure that they are complied with. Question over here.
Let's talk about ships a little bit more. Maybe we can unpack what happened today with the Eurodam. I guess we've got a Disney cruise coming in tomorrow, the Wonder. This looks very different than what we've seen with the Grand Princess and the Diamond Princess, where folks were put into immediate quarantine. Those other ships obviously had positive patients. This one, I guess, didn't, so that must be one of kind of the main differences between the two. But how is it that that you're able to say that these folks all need to be under a 2-week quarantine, and yet can also just kind of go out through the community and use regular transportation to get back to their homes? And also, can you elaborate on the 3 who were sick and had to have local hospital treatment? What did they have COVID symptoms, or did they have something unrelated?
So that's a bunch of questions. Number one, a lot has been learned because of the federal quarantine of the case of the ships that have come in. We've learned a lot at Miramar, for example, of the almost 500 individuals who were there. We've had 5 positive cases now 8 days into the quarantine. So you can see that rate is very low. And those individuals actually had the very slow onset of symptoms. And I think that CDC has learned from its federal quarantine experience and has updated their guidance on what to do when individuals are returning from cruise ships. That's why we consulted with the head of the task force that is managing this. They have guidelines that they use very specifically that have not been published yet, and that's why we had to consult with them and find out what the most current guidelines are. And the current guidelines were met in order for this disembarkation to occur safely. I would actually defer you to CDC on the very specific details, but it has inputs such as reviewing the ship's log to see how many people have respiratory illness, looking at the crew to see if they have any illness on the crew, looking at where the ship started and ended, how long the ship has been at sea. The ship has been at sea for over 2 weeks, and that's an incubation period for COVID-19. So there's a lot of factors that go into the calculation of whether or not it is required to have federal quarantine versus release from quarantine. That's a 50,000-foot level view, but really the details really I address to the vessel sanitation program of CDC and the quarantine station, who is primarily responsible for making these determinations.
What about the sick folks?
We are waiting for information to come on those. The individuals were transported to the hospital in an abundance of caution using COVID PPE or personal protective equipment, but we are waiting for that analysis by those clinicians to let us know whether they have signs and symptoms consistent with COVID. I can tell you I know one for sure does not, but I only had sketchy details on the other two before coming to this conference.
A question over here.
Thanks, Supervisor. Jamie Chambers, Channel 5 News. Quick question. What are the recovery numbers that we have so far? And then a follow-up is, what is the difference between the orders that we're hearing today and San Francisco's current more draconian orders? And if we're expecting to move in that direction, why the pause? Why the wait? And is there some sort of difference? And anyone can jump in on that one.
Well, if you follow the Johns Hopkins, they have number of cases, deaths, and number of individuals recovered. We are not closely tracking the numbers of individuals that are recovering. We are tracking cases and deaths. We may get to that point at a later date, but at this point in time, we're just tracking cases and deaths. And then the other part of your question?
If we're going to be moving to the more draconian lockdown that San Francisco is experiencing, what is that red line? What will determine the heightened restrictions?
Well, the San Francisco area, it actually is 7 Bay Area counties, including Santa Clara, and as you know, they were hit very hard. So the number of cases in that region. But we are actually, I have a 5 o'clock meeting tonight with the health officers in Southern California, and we are going to talk about that next step, going to an overall shutdown or shelter in place. So it's not just a public health decision. If we look at public health, we really do think about what is the health, what's the best actions to ensure the health of our residents. But we also have to look at other factors. So we also be consulting or just having a conversation with other entities so we can make an informed decision for our region. But we're going to be talking with our Southern California health officers tonight to look at that further.
Do you expect us to be into a shelter-in-place situation anytime soon?
I don't know. It is certainly possible, but at this point in time, I couldn't tell you when that would be. Thank you.
If I can just add a quick comment on that, though. What I would do, though, is if I was a person at home hearing the messages that we're giving, okay, that I would think that it is highly likely or possible in the future that that could occur. And so the steps that you can take now to prepare yourself for that eventuality, and going back to our initial guidance of what to do, making sure you have your medications, making sure you have food, you have pet food, things that you and your neighbors and your family can do to be sure that you are ready if that occurs. And I think that it is a clear signal that other parts of the country are doing that, and we're having discussions on that, so it should not be surprising if that happens in the future.
Okay, we have a question over here. One
so
question.
He asked questions, so.
We'll get to you.
So I want to talk more about unsheltered individuals. We're talking about many people that may not have a healthcare provider, some of whom don't even have a charged cell phone. And I know that you talked about the fact that there will be increased outreach. But what is an unsheltered homeless individual supposed to do if they notice that they have symptoms or they're in fear? What is the proper protocol for them? I've been hearing from people calling 211 and getting mixed messages as to what they can do or what might be accessible to them.
Well, I'll start in responding to that question and then allow Supervisor Fletcher to make additional comments. As you recall, during hepatitis A outbreak, we had foot teams. So that strategy has not ceased since the outbreak. We still have foot teams going out into the community with the hot teams to look at if there are any issues or needs of our homeless population. So we are ramping that up to focus on COVID-19, and very much like what is occurring in the shelters, we will do the same thing for the unsheltered individuals if we find them to have symptoms, influenza-like illnesses, or COVID-19 illnesses. So we will be doing the same thing. We have nurses going out into the caverns and locations that they went to during hepatitis A outbreak. So that's what we're doing. Does that answer your question?
I do think that there's a concern, and I've talked to some people on the phone who feel like they might be at risk, or they're concerned maybe somebody's coughed around them, and it sounds maybe silly to us, but we can go home and shelter in place if that's what the directive ends up being. They don't have a home, and literally a lot of shelters are not intaking right now because of this. So I guess I would just ask from there, I mean, obviously you are increasing outreach, but we're talking about thousands of people in our county that are living on the street.
On the streets, and what we are doing with the foot teams is going out and identifying individuals that have symptoms, and the same process that is being implemented for shelters. The person is isolated, then they are transferred to the accommodations that have been secured for them. We will do the same thing with these unsheltered individuals. So Supervisor Fletcher, do you have any additional comments?
No, it's a multi-pronged approach, and the scope of the problem is very big, and we are doing everything we can as fast as we can. I think the public health nurses at the shelters, and as we work to expand that presence to other shelters, gives us a first line of defense of checking those folks, surveying those folks. If you identify someone with the symptom, you get them out, you get them in a motel. Now they have access to the appropriate level of care and isolation that they need. Then now that opens up a bed. As we work with our shelter providers to screen new people coming in, that gives us another point of contact and entry. As we work to get into 16 hot teams, that gives us a broader spread of looking for individuals who may have symptoms. And as we work with our homeless providers and all of their outreach folks to give them information on how they can access the entry point into these services, that gives us another one. But we know in all of these areas we have to do more. And we will continue to do more in terms of ramping up those activities and operations.
Okay, this will be the last question, but I believe the speakers will be available for other questions afterwards. Go ahead.
Jennifer Dela Cruz at Channel 10. Dr. McDonald mentioned we do not have enough tests. I know they're being prioritized for those more vulnerable or with underlying conditions, but we have a lot of people calling and saying they've gone to a doctor's office and they can't get a test. You said we don't have enough. Do you have a timeline on when we will be getting more?
Well, I'll be honest, no. I mean, that is a national problem that has been addressed at the national level. We are sort of the end users, and we are really highly dependent on the commercial labs and the CDC and the companies that make the reagents to be able to distribute them. So it is again, it's a national problem that I don't have visibility at that site. That's a great question to be asking our national leadership.
And one more thing, we've also had people concerned about public transportation. I know you are cleaning the trolleys and buses, but we have viewers saying that there's no regulation for social distancing and that people on the trolleys and the buses aren't following those rules. Is there anything that can be done to regulate that?
The second question that you just asked, I'm going to defer to Dr. Wooten in a moment. But I want to make something clear for the general public in terms of the issue of testing. Everybody who wants a test will not necessarily get a test. Part of what we are facing as the community transmission in our region continues is the priority that our public needs to heed of how important, in support of everything that Dr. Wooten has laid out, it is for individuals who have mild symptoms to stay at home. We are not in a position for every individual who now has a fever or a cough to necessarily be demanding a test. There is a process of communication between most individuals and their healthcare providers to sort out those dynamics. One of the things that I want to ask in terms of the question that was asked about 211, the county yesterday did something new and very innovative, realizing the volume that is now increasing of calls coming into 211, that we, the county, in collaboration with 211, have set up a nursing call center to be able to provide individuals who may not have access to either their own medical provider or perhaps are having difficulty because of wait times to be able to get medical advice from another source. That is the kind of innovation that we in San Diego are actively pursuing. But it is very important that at some point, and we are getting near to that point, the test supply that we have got to be maintained for the people who need it the most. There are national issues at play that have limited our capacity to be able to provide tests for everybody in our region who would like one. Dr. Wooten, if you could address the transportation issues.
Transportation is an essential service for individuals that are still going to work or still, there are essential service personnel that might need to use transportation. We are still asking people as they are on the trolley or the bus to try to adhere to as much as possible the social distancing recommendations. So we are giving these recommendations, and in some cases they might not be possible. We're asking people to try as much as possible to adhere to them. And again, I would like to acknowledge the great work and cooperation of the many businesses. We issued the order, our first order, this week. It was effective midnight on Tuesday. And in less than 24 hours, many businesses have started to comply. I went to a restaurant to get dinner after leaving the COC last night at 8 o'clock. And the business had moved all of the tables to the side so that people could not sit down and dine in. They could only come in and order. Everyone is doing their part, and if everyone does their part, we will get through this. And we know that it won't be 100%, but at least if 80 to 85, 90% of people cooperate, we will get through this together. Oh, and just one more point with the transportation. We know that MTS and all of the facilities or entities that are involved with transportation are doing that enhanced sanitation. And we encourage that, and actually that was included in our first order. So the enhanced sanitation and people that are utilizing the services to try to adhere to social distancing as much as possible.
Okay, we're going to bring this to a close, but just a couple of points I want to emphasize. The changes from the previous directive is that all gyms and fitness centers should now be closed, and that childcare must be carried out in stable groups of 10 or fewer children. In other words, stable groups that aren't going to be changing from day to day. The children, if more than one group of children is cared for at one facility, each group shall be in a separate room. The groups shall not mix with each other, and child care providers shall remain solely with one group of children. That's for the protection of the child care workers and also the children. Gatherings of any group larger than 10 are prohibited. And again, we ask groups of smaller than 10, if you get together, to keep that social distance of 6 feet away. So thank you for being here. I do want to acknowledge that we've really been very proud to see the response from the community. As Dr. Wooten and others have stated, businesses have already started to implement changes. Some of them did it even before the directive came out. And I want to give a special shout out to, I know we got a lot of businesses that are really going above and beyond what the directions are. And I know that Northgate Gonzalez is, I think, the first grocery store to start this. And I know that there's others have been following this trend, including Targets and Albertsons and Trader Joe's, where they are opening up their stores an hour earlier for seniors and for those with disabilities and those that may have compromised immune systems to come in and shop in a less congested environment. This is a great example of how people in this county are coming together, working together. As been said many times over, we're all in this together. So with everybody's cooperation, if you can follow these directives, if you can be polite, if you can keep that social distance and stay isolated, if you have a compromised immune system and are feeling sick, we're going to get through this. And with that, we will go ahead and conclude the comments for today. If there's other questions, you can talk to individuals one-on-one. Thank you.